Welcome back. With COVID-19 cases currently having exceeded 9,000 nationally, there's been concerns about the current trajectory of new infections. This indicates we may see around 3,000 new infections per day by 31 May and 26,000 new infections per day by the 30th of June because of poor implementation of screening, educating, testing and tracing strategies. Professor Alex van den Heever from the Wits School of Governance joins us now to discuss the importance of the role played by the National Coronavirus Command Council during this time. Alex, so those numbers are quite alarming and they don't really gel with what we're seeing at the moment, but that's exactly what you're saying, is that there's a disconnect between what we're seeing currently due to improper or insufficient testing. Just so that we don't come across as alarmist, where do those numbers come from, the 26,000 possible new infections per day for June?
So essentially it's taking the, projecting forward from the increased trajectory that we're seeing now, because it's suggesting that our reproduction rate of the epidemic is above 1. And this shouldn't be the case if we had effective prevention strategies in place. So for instance, the introduction of a lockdown within the context of China or even Italy and Spain would have resulted in the epidemic turning down. In other words, the reproduction rate of the disease declining, not increasing. And there might be a lag when you've got huge epidemics such as you had in those contexts. Now, we didn't have a huge epidemic. We had a relatively low-level epidemic. So what we should have seen was that a curtailment or a suppression of the new infections. So given that it was a relatively heavy lockdown, what we've instead seen is that initially there was a suppression of the epidemic, but that was moving from one community to another. And when it shifted to the general population from the sort of relatively affluent population, you suddenly have the steep increase and it's not turning back. So this is purely taking a straight line forward over this period. If we continue on this trajectory, that's what we will see. So the question is really, what did we do during the lockdown to introduce the strategies that would work to actually bring the reproduction rate of the epidemic below 1? And that's my concern. We haven't seen that, and it's not clear whether we will have the capability to do that in the next month.
Alex, so you've identified a couple of inconsistencies that you've picked up in how we've handled the lockdown and the kind of regulations and policies that have been put in place. Just lift some of those out for us.
Well, I would have expected so firstly, the point of the lockdown was to buy us time, which it did do. To buy us time to put in place the kind of health prevention strategy that would be consistent with the South African context, which is different to Italy, different to the United Kingdom. So what we should have been introducing and setting up the platform for was a very substantial scaling up our testing and contact tracing strategies, which are really the only ones that can contain the epidemic in our densely populated townships and informal settlements. So what we effectively didn't put that in place. And there is actually no alternative. So the lockdown itself can't contain the epidemic in those areas unless you become extraordinarily draconian. And in fact, those are still quite vulnerable communities. So instead, what we did during this period was to shut down the economy, which removes government's ability to be sustainable over a long period of time, which we're going to have to be for this epidemic. But it also essentially brought in Cuban doctors that don't really have any material, we don't really have a need for them as part of a prevention strategy. They would only be necessary if our strategy fails and we essentially have to treat people as inpatients in hospitals. So the inconsistency is that there was no prioritization of the only prevention strategy we had available to us, and that is a concern.
So you're saying that we need to be doing upwards of 20,000 tests per day. I believe currently our average is around 10,000. You're accusing the government of complacency. However, the government argument has consistently been that it's under-resourced.
On a strategy like this, if we had to test at a level of, say, 30,000 per day, it would cost us several billion rand, maybe upward of 8 billion rand a year annually. The lockdown costs us around about 13 billion rand a day. So the cost of resourcing a full-scale testing program, even at twice or 3 times what I've just indicated, would be very cost-effective within the South African context. So because when we lock down, we're essentially shutting off the supply and demand side of the economy, and we're undermining government's sustainability over to manage this epidemic, which is going to be with us at this point in time for the foreseeable future, potentially for about 24 months. So unless something happens that is not apparent yet, such as a vaccine, it's with us for a long time, and lockdowns are off the table. So our only strategy is to commit substantial resources and capacity to scaling up testing and tracing. And it's not just testing and tracing. You have to get the test back rapidly. You have to get it back on the same day as the test. And you also have to identify all the contacts within the same day as well. So if you look at the other countries, they're investing in contact tracing apps. They're investing in the testing machinery to be able to respond rapidly. And even though that you don't have it in day one, you make sure that over a period of time, you're going to have that capacity in place. We didn't invest. We've had 2 months to get this to get something in place. And what we haven't seen that ramping up. We're getting tests back between 2 and 7 days, some of the provinces are indicating. And half of our tests are not those that are by the government. They're by the private sector, who are really only testing symptomatic cases arriving at hospital. So the public sector testing is considerably less than our total testing. So there we're looking at, say, around about 5,000-6,000 a day. That is totally below our requirement for testing, part of a prevention strategy.
Alex, the role played by the National Coronavirus Command Council has come under question in the last week, specifically with the pending court action by political parties, among others. They've been criticised for not revealing their decision-making process. Do you agree with that criticism?
I do agree. I think that in all instances, government has a duty to explain and to provide reasons for its decisions that it makes. Unless you have some compelling reason to keep information away from the public. So, for instance, if you were at war with another country and you wouldn't want to reveal that you've discovered their codes, you might want to keep that secret. But when you're dealing with an epidemic, you want to keep people informed, particularly if your interventions have a severe impact on people's businesses and the economy as well as their lives. So the question is, why is there no information that is systematically available? Why is information held back? So the key decisions, let's say, for example, the tobacco decision and the alcohol-related decisions. People shouldn't be drinking excessively and people shouldn't smoke, but it's their decision as to what they do. It's not a decision of the Command Council to decide for them for some other public health reason, when in fact the emergency regulations that have been legislation and the associated regulations are only associated with the purpose of managing this epidemic. So the question is, what health prevention rationale was there? And the moment you start to do things that you can't explain, then trust is removed from the situation. And other countries may be different, but in South Africa, our constitution requires that what government does can be explained to the public and must be explained. There must be a rational purpose behind what they do. It must be reasonable, reasonably considered and reasonably implemented. And right now we don't have a supervisory process around what's happening within the Command Council, and we don't really have real insight into the specific decisions that are being made. And I think that is worrying, and it must end.
Thank you very much. You've been speaking to Professor Alex van den Heever from the Wits School of Governance.